Hello, my name is Tammy Caldwell. I'm going to be teaching y'all how to do an adult manual blood pressure reading. I have a PowerPoint that I'm going to present to y'all. I'm also going to ask you or kind of talk to you about some different kind of learning methods, as well as why you need to have your blood pressure checked and how often. Before we begin, I'd just like to ask each of y'all, how best do you learn? Do you learn better by reading something, watching a video, doing a hands-on, or watching somebody do it?
Hands-on.
Hands-on. How best do you learn?
Watch somebody do it.
Watch somebody do it, okay?
Yeah, that's it.
More hands-on, I think.
Hands-on. Hands-on.
More hands-on, okay. Well, y'all are in luck because y'all can get a chance to do that. I'm going to show y'all how to also do a blood pressure, and then whoever would like to volunteer can try it as well. So, let's begin. How is this done? Before we start about how to actually do it, what we're going to talk about is what blood pressure is. Mainly it's the force of the blood against the arterial walls, and we record it in two different measures. We do a diastolic and a systolic. An example would be 120/80, which is normal for most adults, and it would be read as systolic over your diastolic, which is that what systolic would be the 120, and the 80 would be the diastolic. Why do we need our blood pressure checked? According to statistics, 1 in 3 people, especially women, have high blood pressure. So they need to get it checked more regularly than men. Men who are in high pressure jobs need to get theirs checked regularly than people who aren't in high pressure jobs. They also can cause a long-term heart damage, brain damage, vessel damage, and kidney damage. For example, people who have high blood pressure tend to have a tendency to have heart attacks. They can have aneurysms. They can also have arteriosclerosis, which is the plaque building up in the veins. And then also with the kidneys, if you have high blood pressure over a long period of time, then the pressure in the kidneys builds up, and it'll basically knock the kidneys out, the function of the kidneys, which leads to a whole other group of problems. So let's just get that over there. Things that affect changing of the blood pressure include if you have high blood pressure, which is called hypertension. If you're diagnosed with high blood pressure, you need to have regular measurements. And high blood pressure is considered 140/90. And you have different stages of hypertension. This shows our pre-hypertension. Pre-hypertension is anywhere from 120 to 139 or 80 to 89. In that category, it doesn't mean you have hypertension, but it means that you are more at risk to get hypertension according to whatever lifestyle, dietary habits, and things like that you're doing in your life. And if you're in this range, that's just kind of like a little wake-up call to say, hey, you need to do better in your lifestyle. You need to start eating fresh fruits and vegetables, decrease your salt intake, drink more water, less carbonated beverages, and things like that to try to get it down. Especially, and also in your meats, more lean meats instead of your high fatty meats. Like pork is a lean meat, but it does make your blood pressure go up. It says, especially for African Americans. But more like your chicken and your fish, which are higher in good fatty acids and things like that, which also help your blood pressure stay down. When you're getting to stage 1 hypertension, this is whenever most people are diagnosed with that first off. And then that's when they're going to start trying to get you to change your diet habits, change your exercise habits, and then if that doesn't work, then they'll kind of start you on medication. And even some doctors will go ahead and start you on one type of medication to try to get it back down into the normal range, which is 120/80 or less. When you get into stage 2 hypertension, and I've seen this a bunch in the ER, some people don't know that they have it. They don't go to the doctor regularly, and they come in with this excruciating headache, or they're really dizzy, And so they check them out for maybe possibly a stroke, and sometimes it's just their blood pressure is like 210 over 100, you know. So they have to be followed up with their regular doctor for that. And then sometimes you don't have any symptoms at all. You just go to the doctor and you have high blood pressure. And then they'll try to get you started on a regimen. Another thing is hypotension, which is low blood pressure. Low blood pressure is kind of uncommon, but most people do. I mean, some people do have it. It's not a specific measurement that's considered low. Anything that's 120 over 80 or less is considered normal unless you have symptoms. If you run 90 over 64 and you have no problems and you don't have any dizziness or any weakness, you know, when you stand up you don't feel like you're going to fall out, then that's your normal. If you are 90 over 60 and you stand up and you fall out, then you're more likely going to be diagnosed with hypotension or low blood pressure. So these are some of the reasons why you need to know what the numbers are for blood pressure. Going back to the manual blood pressures are the best blood pressures to take. Now we have the mechanical ones, and theirs are really, really, really great. And they're really convenient for people who can't take their blood pressure on themselves. And those are good to have in between doctor's visits and things like that. But if you have a mechanical blood pressure cuff and it reads high, then you need to go to the doctor and get an actual manual reading. And I know that a lot of doctors still do the manual blood pressure cuff readings. So again, that's another reason why we should know what our numbers are, what to expect whenever we take blood pressures, or whenever you take your own blood pressure, or if you take somebody else's, so that you'll know what's going on. Some things you need to know about the actual blood pressure cuff and the instrument that you're going to use to put the blood pressure with. Now they have a little description of each part of the blood pressure cuff up here. But the little bowl is called a pump. And that's what you're going to pump up the blood pressure cuff with. Okay? There's a little silver piece on there above the valve, and that's called, above the pump, and that's called a valve. And that's what's going to keep the blood pressure cuff closed and open it to let the air out. Okay? The actual circular object is the cuff. That's what's going to go around the person's arm or your arm. And then this wonderful little meter is your dial. And it's going to tell you what your numbers are. And it has numbers on them. And I don't know for sure right off the top of my head if they do have bigger number dials, for people who have trouble seeing smaller numbers. But they make them relatively, where you can see the even numbers. Now, the problem that most people would probably have a problem looking at are the little notches on it, in between the big numbers. The other part that we would be using is called a stethoscope. And the stethoscope has the earpiece is here, and this is the tubing, and this is the diaphragm. The diaphragm is what you're going to put on the skin at the pulse rate, so that whenever you pump it up, you can hear it whenever you can hear the diastolic and systolic beat. Mine actually has another one, but that's for another lesson. So those are just some of the parts, and you kind of need to get familiar with the parts so that you'll know how to put it on, and how to pump it up. Most blood pressure cuffs are going to come with a let's see if I can get it off here, kind of a self-help directions, especially the manual ones. If I can get this one off, and it tells you where you need to put it on your arm, and it has a little arrow where you can put it. The other thing with blood pressure cuffs is that not all blood pressure cuffs are going to fit everybody. The majority, the ones that come normally, fit the majority of most people. But you do have chunky ones like me, and it's kind of hard to get. You have to find ones that are large or extra large, and you fit it to the person, because if you don't get the correct size cuff, your blood pressure could be wrong. It could be either too high or too low. Usually if you have a bigger size cuff, it's going to read lower on someone who's smaller, I believe. And if you have a smaller size cuff and you put it on somebody that's bigger than it is, it's going to read higher. So you just try to match it to the person that you're going to do it on. And these also have the arm circumference in inches. So if you feel like breaking out your tape measure to measure a person's arm, you can, and it has the range on it for you. Let's see. Now the steps for the blood pressure cuff, or the blood pressure, I'm sorry, for the checking the blood pressure. And I have some handouts in my hand. I'm going to give it to y'all so that you can keep on your own. Let me pass those out real quick. You'll just want to pass it around. That's just kind of something to remind you of. If you forget how to do it, you have it on there. Okay, everybody have one? Normally what we do is we wash our hands. This is mostly the medical field. However, if you're being at home, you don't have to do that. Again, choose the correct size cuff. You need to find the pulse at the bend of the elbow, usually around here, depending on which side. It's usually in the center, and you can usually find it if you can see your vein. It's usually in the same place on both sides, and you can feel it. Sometimes you may have to go to the left or the right. Everybody's different. You would wrap the cuff snugly around the arm, around this part right here. You would strap it down. You'd make sure that your valve is cut off, and you would pump up. Normally you would pump it up to about 200 pounds. You kind of guesstimate with the person. If the person is 250 pounds, then you would pump it up to about 250 to 300 if it without breaking their arm or them screaming in pain. And then you slowly release. I'm sorry, I left out a very important step. You put your stethoscope in your ears and put the veil on the pulse. You may not be able to hear it at first, and that's fine, but once you pump it up, you'll hear it. When you pump it up to, say, about 250, you slowly open the valve and let the air come out slowly. Once you hear that first thump, that's going to be your systolic. And then you'll slowly let it out, not too slow, because it does kind of hurt, or tends to hurt. And when you hear the last thump, that's your diastolic. So whatever the first thump was over the last thump. And usually it's, people who are normal or around normal is 120 over 80. Then once you hear that, you don't have to let it out, still let it out slowly. You go ahead and open it up and so it can go ahead and release, and you can take it off. Okay, and any questions at this time? Okay, all right. You, sir, come here. I'm going to show you how to do it really, really, really quick. Roll up the sleeve for me.
Roll your sleeve up.
Roll your sleeve up, sir. Oh, gosh. Okay, I'm going to improvise. We're going to do this over the sleeve. This is not the way you would normally do it. Let's see, but can you get up in there?
I can do it. I do.
Alrighty. Alright, I have the blood pressure cuff about midways of his arm. Try not to pinch it. Doesn't have to be tight. And you can feel what you can feel. Sorry. You can feel your pulse before you do it. And sometimes you have to kind of move around, but usually it's right in the middle. Okay. And I'm gonna look at. I'm not gonna push it down hard, the diaphragm. I'm just gonna hold it with my finger. I'm gonna tighten the valve. And I'm gonna do about 180, maybe 200. And he thumped at 150. And he finished at 82. So his blood pressure is 150/82. And then you slide it off. Alrighty. Does anybody have any questions or anything?
So his is high.
Yes, a little bit.
But
Did
he
you
is-
take your medicine? He could be nervous.
He's a truck driver too, so.
I do have just a quick little test. All you have to do is tell whether the pressure, whether you think they're normal, high, or low, and then also just a little another little questionnaire about the name and the parts of the cuff, just kind of see if we are on the same page and if we did it correctly. And then I also have an evaluation, or you can evaluate me and the presentation. No questions? All right, well, I would like to, do you have a question, ma'am?
No.
Well, I'd like to thank you for joining me here tonight and for allowing me to give you this presentation on how to take manual blood pressure cuffs. Thank you.